My name is Michelle Bass-Williams. I am a double lung transplant recipient. I was transplanted on December 9th of 2012, and my transplant number is 1,249. I was diagnosed with interstitial lung disease approximately 9 years ago by Dr. Anthony Shin at Missouri Baptist. He had explained to me that this was a non-aggressive disease, but 3 years into the diagnosis, I ended up having to have a double lung transplant. It was Labor Day weekend of 2012. I was letting our dogs in, wiping their feet off because it had rained, and I bent down to wipe their feet off, and when I came up, I thought I was having an anxiety attack, but a couple months later, we found out that I wasn't, that the interstitial lung disease had progressed aggressively, and it required me to have a double lung transplant. So I was admitted into the hospital right after Thanksgiving of 2012, and I was transferred. I went into Missouri Baptist, then I was transferred to Barnes after some tests being done there, and then the lung transplant team evaluated me over about a week and a half period, and came in and explained to me, what would occur, what their expectations were of me after transplant, during transplant, and before transplant. I know it's kind of backwards, but that's just kind of the way it happened. So we were told that, my husband and I were told that before the transplant that if I would need to lose weight or if I would need to gain weight. Luckily, I didn't have to do any of that. I was at the perfect, I guess it's called a BMI, so I was very fortunate. So after the evaluation, the group of doctors came in on a Thursday and told me and my husband that I was approved for the transplant. Did we still want it? Of course, we said yes. And they put me on the national list on a Friday. It was December 7th I was put on the national list. December 8th, on a Saturday evening, the night nurse came in to let me know that they had found lungs for me, and it was a 3-hour commute. So we didn't know if it was by plane, train, or car, but we were very excited. And pretty much after that, I really don't remember a lot. Everybody said that I was alert and coherent, but I really kind of shut down at that point. And I had my transplant on Sunday, December 9th. I believe it started the surgery at 5 in the morning. And my husband said it took about 5.5 hours. I did have some issues, I believe, with my heart, which is common, especially as sick as I was. So I believe my heart was on a bypass. Mike will be able to explain more about that when he does the interview, excuse me, as my caregiver. So I believe I was out about a day and a half before they brought me out of the medication, and they have you get up immediately. They don't, let you lay in bed. You're up and going, and they want you walking and, breathing in some, I don't know exactly what they're called. Mike may be able to help better with that, but to clear your lungs so you don't get pneumonia, because your body is fighting against your new lungs, saying these are foreign, they don't belong here. So you're on quite a few medications to help stop that. So your immune system is suppressed. So I'm immunosuppressed and take 3 anti-rejection meds twice a day, every day, for the rest of my life. Which is fine. I'm happy to be here. Very, very grateful for my donor. The only thing that I know is that she's a woman, or was a woman, Caucasian, 58 years old, and 3 hours away. So I have contacted the family on a number of occasions in hopes that they would respond. I would love to meet them someday and them meet me, because I have her in me. I have her lungs, and she saved my life. Without that, I wouldn't be here. I fell off the cliff pretty quick with regard to the interstitial lung disease. And then under interstitial lung disease, there's an underlying disease called idiopathic pulmonary fibrosis, and they refer to it as IPF. And that's what I had, which really means they don't know what it means. There's not a lot of research done on that, so there's really no cause for it. It just occurs. And since I've been a transplant recipient, I've met a number of people that are IPF related as well, which is comforting in a way, because they understand what I've been through, and pre-transplant and post-transplant, which is good. And Tom Archer was one of those people. One of the most amazing things for me is to be a part of Second Wind. And it's kind of a long name. It's Second Wind Lung Transplant Association of St. Louis. It's a nonprofit organization that helps pre and post lung transplant recipients and their families. So that's amazing. It's on a volunteer basis, and I love being a part of that because I'm connected with many other people that have had double lung transplants as well. And it's amazing to hear their stories and to be involved in the organization. So we're going to step back a few, milestones. Earlier I had indicated that I thought I was having an anxiety attack, and I wasn't. I actually, after meeting with Dr. Shen, I did go on home oxygen for a while, I believe the beginning of October, until I went into the hospital at Missouri Baptist. And, I did not get to do the pre-transplant procedures, which is working out, losing weight, getting strong, getting your body strong and healthy, because it's very difficult for an individual to go through a double lung transplant. Your body, it wears on your body terribly. But I was extremely lucky that I was a walker. I walked a lot. I maintained a good weight, and I ate healthy. But the flip side of that, of not being able to go through the pre-transplant information, is that you're not prepared for what is going to happen mentally. So mentally, I was extremely, extremely depressed. And I went into it that way. Mike and I had to make decisions basically without having a lot of time to think. And it was extremely overwhelming for me. My husband did a great job. He's an awesome caregiver. Couldn't have anybody better than him. So during that depressing time, before transplant, and then it got worse after transplant, and it even got worse when I went home. Because you're on all these different medications, you have to know the names of the medications, the dose that you're taking, when to take them. I was also medically induced diabetic. So I had to check my blood sugars 3 times a day before each meal and before bedtime, and I had to take insulin for about 6 or 8 months, which I had never been a diabetic, so all of that was new to me. And already being in a depressive state, that made it much worse. So I pretty much was a couch potato from the time I got home in early January until about June or middle of July. And my nephew had come in town from Norfolk, Virginia. He's in the Navy, and I didn't get to see him at Christmas time when he came in because I had my transplant in December. And he had a cold, so he could not come visit me. So that was disappointing for both of us. But it was safer for me not to have anybody around that had a virus or a cold or anything, because I could have easily caught that, and it could have caused lung rejection, which we don't want. So he came in town for 2 weeks, and I was very fortunate to spend that 2 weeks with him. And as fast as I was in depression, I came out of it, just being with him. I believe he was the angel that God sent me, and I'm very grateful for him. So I have been living life every day like it was my last day, or it is my last day. You have a new appreciation once you go through something like that. I honestly probably should be in heaven, with our Heavenly Father right now. But for whatever reason, He's given me a second chance to live, and I'm very, very, very grateful for that. If He didn't, if He took me to heaven, I would not have been able to be a part of my grandson's birth, Camden, who is now almost 2.5. I wouldn't have been able to see my nephew get married. There's just a whole host of things, life events that occur that I would not been able to be a part of had this woman not decided to be an organ donor, and her family, approve it and respect her decision, which, many times I know is difficult for families. I am an organ donor as well, and so is my husband. And we've encouraged many, many people to sign up to be organ donors as well. It's the gift of life. What better gift can you give someone is the gift of life. And I'm very proud to be a part of that. And I would do it all over again, once my lungs wear out, I hope I am eligible for a second lung transplant. I hope I am, blessed enough to go through that again. I would go through it in a heartbeat. No questions asked. It's been an amazing journey for me, for my family, and friends, and it's just been brought a new perspective to life in general. I've always pretty much been a easygoing, happy-go-lucky person, but this has even made it more prominent in my everyday life. And I've been fortunate enough to retire from work, and I get to watch my grandson 3 days a week, which is fabulous. And then to make some extra cash for me, I clean houses twice a week, which I enjoy. It's good exercise for me, and I earn a little bit more money. I guess the biggest struggle that I would say I've had is the medication changes. You go, or I go once a month for my clinic visit, and they do a chest x-ray, they do blood work, and then you go have a pulmonary function test, which is a PFT. You're blowing your air into a machine, and it grade you on how much oxygen you have and how much air you can blow out. And of course, the higher the number is, the better lung capacity that you have. But there are times when I don't do very well, and they get concerned, and they'll adjust my meds accordingly, or my blood work will come back, and they'll have to adjust medications. It's usually the rejection meds, the Prograf, the Cellcept, and the prednisone. Those are the 3 anti-rejection meds. And then I'm on a host of other ones as well as preventatives. So I guess during my 3.5-year journey, I have caught a number of viruses. Out of all of them, probably I think 2 I've been hospitalized for, which wasn't a big deal. I just did some breathing treatments. There were 9 breathing treatments that you had to take, and it was over a course of 3 days. So every 8 hours, you took a breathing treatment that lasted 2 hours, and you did 9 of those, and then you got to go home. So I've been very, very lucky. So far, I have not experienced chronic lung rejection, which is what we all want to avoid. So, they tell us, the lung doctors tell us that, the average lifespan for a set of lungs is 5 to 7 years. But I have met tremendous number of people that have been way past that. I've met someone that's at 19 years. I've met someone that's at 26 years. It's incredible. So, my best advice to anybody that would need a lung transplant, a double lung transplant, is to listen to your doctors. Do every single solitary thing they tell you to do. If you have questions, you call your coordinator. You're assigned a coordinator, and I've been blessed enough to have Carol and Tracy. They're awesome. And, they meet with the doctors on a regular basis regarding my case. They follow me. And I do not hesitate to call them at any time. As silly as it may sound to me, or if I'm embarrassed to ask a question, I don't. I push through that fear or embarrassment, and I call them and ask them. And which is great. I want to hear it from the horse's mouth. Facebook is a great social media, to ask questions, but you really do need to contact your coordinators and your doctors. And, do the meds at every day at the time you're supposed to. Don't, if you're supposed to take them at 9:30 in the morning and 9:30 in the evening, do it. Don't wait. Don't take them an hour later or 2 or 3 hours later. The meds don't have the same effect on you as they would if you take them the same time every day as you're instructed. Exercise, eat right, do all of those things. It will prolong, it'll give you longevity with your lungs. So in a nutshell, that's pretty much my story. Just happy to be alive and live every day and every second as if it were, my last. So that's pretty much it.